Having a beautiful smile and straight teeth can definitely impact our self-confidence, and the most important treatment recommended for straightening teeth is orthodontic treatment. Many of us think that orthodontic treatment is completely safe and won't cause any problems for us. But did you know that if you don't follow a few things, orthodontic treatment can lead to loose teeth or even tooth loss? Hello, I am Dr. Etemadi, dentist, gum and implant surgeon. In this video, I'm going to talk about the risks of orthodontic treatment and how to prevent problems related to orthodontic treatment. So if you're planning to get orthodontic treatment or want to know more about these issues, don't miss this video and stay with me until the end. And if this is your first time visiting my channel, please make sure to subscribe and don't forget to like the video. Orthodontic problems and dental misalignments after tooth decay are the most common dental issues that can affect us. And according to studies, between 40 to 60% of people in society need orthodontic treatment. As I mentioned earlier, this treatment can be accompanied by a series of side effects. In this video, I will first talk about the physical side effects of orthodontic treatment and then about the psychological side effects. The most important physical side effect of orthodontic treatment is tooth decay. After you start your orthodontic treatment, usually a series of wires and brackets are attached to the surface of your teeth. These wires and brackets make brushing your teeth more difficult. They make it harder for you to maintain oral hygiene. As a result, you become prone to developing tooth decay, which usually starts as a series of white spots, and over time, if you don't take care, it can lead to obvious cavities and those decayed holes on the surface of your teeth. The next problem that orthodontic treatment can cause is gum disease. Because you can't brush your teeth properly, there's also a chance that gum disease may develop in you. Your gums may bleed easily. Your gums may become inflamed and swollen, but by improving and maintaining your oral hygiene, you can prevent these two complications. The next problem that orthodontic treatment can cause for you is gum recession. For people whose teeth are angled inward before orthodontic treatment, when they undergo orthodontic treatment and their teeth are supposed to be angled outward and move outward, the likelihood of experiencing gum recession and the roots of the teeth becoming exposed from the gums is very high. Another problem that can occur is root resorption. Root resorption is an issue that happens quite commonly during orthodontic treatment. Since forces are applied to the teeth during orthodontic treatment, if these forces exceed a certain limit or are not applied properly, there is a high chance that the person will experience root resorption, causing the roots of their teeth to become shorter. This issue is especially common in people whose orthodontic treatment takes a long time, who have extensive tooth movements, and as I mentioned, when heavy orthodontic forces are applied to their teeth. Another problem that can occur during treatment is tooth mobility. Usually after you start orthodontic treatment, your teeth become a bit more mobile, but this mobility is neither excessive nor painful. But if the mobility becomes painful or if your teeth become very loose, it indicates that either your dentist is applying too much force or you had an untreated gum disease that has now become active and is aggressively causing bone loss in your jaw. This severe loss of gum and jawbone can lead to the kind of mobility I mentioned. The next problem that orthodontic treatment can cause for you is tooth sensitivity and pain. There are two types of pain that may occur during orthodontic treatment. The first type of pain happens immediately after the orthodontic wires are reactivated. You visit your orthodontist once a month. The orthodontist adjusts the wires that are attached to your teeth. They readjust them, and this readjustment causes you to have pain for 2 or 3 days. Your teeth become sensitive. This pain goes away after 2 or 3 days and isn't too concerning. At most, you take a painkiller and the pain is relieved. Another type of pain, which is dangerous, happens due to severe tooth movements, and in these cases, the blood supply to the tooth nerve becomes somewhat compromised. It decreases a bit, which causes inflammation of the tooth nerve and makes the tooth sensitive. It becomes painful. In some cases, this pain can even make it necessary for you to get a root canal on your teeth. In addition to these types of pain that originate from the teeth, it's possible that the orthodontic wires have sharp edges, which can irritate your cheek or lip and cause sores in this area, and this can also be painful. In these situations, the orthodontist usually applies orthodontic wax to the surface of the wires, which actually covers the sharpness of the orthodontic wires and brackets. As a result, there is less irritation and sores do not occur. Another problem that might occur during orthodontic treatment is allergic and hypersensitivity reactions. It's possible that you may be sensitive to some of the materials used during your orthodontic treatment. For example, you might be allergic to the interbracket elastics, or to the metal of the brackets themselves, or even to the metal of the wires. In such cases, you should definitely inform your orthodontist so they can use alternative materials. For example, they might use plastic brackets or non-latex elastics for you. The last problem that might occur during orthodontic treatment is issues with the jaw joint. If your treatment takes a long time or your teeth need to be moved significantly. If you had a severe skeletal or dental abnormality before orthodontic treatment, it's possible that you may experience pain in the jaw joint area during orthodontic treatment. In addition to physical issues, orthodontic treatment can also cause us some psychological problems. Since classic orthodontic treatment involves changes in a person's appearance, it's possible for someone to feel embarrassed to appear in public, and in these situations, it's very important for the family to support them. It is also recommended that if appearance is very important to you, use invisible orthodontic treatment so that your appearance doesn't change. So, what should we do to avoid these problems? The most important thing you should do is to visit a dentist before you even start the treatment. Check your teeth to see if you have any tooth decay. At the same time, you should check your gums to see if you have any active gum disease. If you have active gum disease and start orthodontic treatment, this disease will definitely progress much more rapidly and can even lead to severe tooth mobility and significant jawbone loss. In addition to this, during orthodontic treatment, not only should you be under the supervision of an orthodontist, but you should also be monitored by a periodontist so that the condition of your gums is constantly checked. If any issues such as gum recession or severe gum inflammation occur, the periodontist can address and treat the problem in its early stages. Alongside all this, you are responsible for maintaining good oral hygiene. You need to take care of your teeth to prevent them from getting cavities. Make sure your gums don't become inflamed, and if this does happen, be sure to inform your doctor so they can treat you in the early stages. Be sure to use mouthwashes, toothbrushes, and other oral hygiene aids. Constantly clean the areas around the brackets, wires, and gums so that you don't experience gum inflammation or tooth decay. You should also follow a proper diet. Avoid eating sticky foods like toffees or sticky chocolates, as well as hard foods like hard bread or ice. Because these substances can damage the wires and brackets, causing them to break, or they can accumulate around the brackets and be difficult to clean, leading to tooth decay. And the most important thing you should do is to choose an experienced orthodontist. An experienced and knowledgeable orthodontist definitely knows the side effects of the treatment and knows how to prevent them. They do not use excessive orthodontic forces. They do not apply aggressive tooth movements. As a result, the risk of root resorption or jaw problems becomes very low. And finally, I should mention that don't forget, many of the issues I discussed with you are not very common. They might happen very rarely, but there is still a chance, and by being aware of these risks, you can prevent these problems from occurring. Well, I hope you enjoyed this video and that I was able to broaden your perspective on orthodontic treatment and the risks it may pose for you. I kindly ask that if you found this video helpful, please be sure to share it with your friends. Don't forget to like the video, and if this is your first time visiting my channel, make sure to subscribe and check out my other videos as well. I hope you stay healthy and well, and until the next video, I wish you all the best.